the distinction between sex and fetishes. Can you get into that a little bit more?
It all depends, like I said, on the individual. Some people, when it comes to different fetishes, some of it is I have such a high-powered job and I'm an attorney or a doctor, and I have to make decisions all the time, all the time. And everybody looks to me for a certain thing all the time. And sometimes even a vacation, we always say, oh, sweetie, you just need a vacation. You just need some downtime. Still, you have to make decisions on that, where you're going to go, what family members you're going to take, how you're going to pack. All of these, it's almost more to go on a vacation, and it's not relaxing. So when booking a session with someone and structuring it accordingly, it could be, like I said, somebody going through high stress from a divorce. It was more of a mommy thing where I was, we're going to sit down and this is how we're going to do things. You do as I say. And more of a parental person, and taking all of that pressure off of that person's shoulders for an hour or two, or spending the day with someone, and just you almost take everything away from them like a small child. You have to wear this. These shoes are going to match that outfit because I said so. And they don't have to make one decision. By the end of the day, it's almost like shutting off your computer, waiting 10 minutes and turning it back on. I always say it's like rebooting. Just, we're going to reboot today.
Before I went to your foot fetish night, I didn't know of the idea of actual shoe fetishes until somebody paid me not to spend time with my feet, but as soon as he had paid me, he just asked to take off my shoe and spent the entire session obsessing over my shoe itself. And I just kind of, as a third party, watched him spending time with my shoe, and I thought, so what is what's going on here? This is not an act. This is not a pretense. This person is paying me.
I'm really grateful to be here. My name is April Soto. I'm an MD. I'm a physician. I'm a primary care physician. And I love taking care of patients in the primary care field. And what I've learned throughout my career in the past nearly couple of decades, that primary care really has a lot to do with mental health. And so mental health is not separate from general physical health, the mind-body connection.
I'm Anna Yu Lee, and I work in private practice as a mental health consultant, not a psychotherapist.
I started off as a mommy dom at one point and helping people over a hump, helping somebody through a horrifying divorce, things like that, where they just wanted that motherly figure to help them. Ball busting,
what is ball busting?
Literally that, kicking a boy in the balls.
Oh my gosh. Okay, so Ms. Stone, let me just tell you, I couldn't believe it. I was at one of your parties, and one of the gentlemen was taking my feet and, just moving it toward his middle section, and I kept on kicking his genitalia, and he was thrilled, at least from all apparent physical signs, and I couldn't figure it out. Isn't that an area of great sensitivity?
There's two parts to that. One, you can pull your foot back and go, hey, we didn't negotiate that, shame on you. No. Like tapping the dog on the nose. No. You did not negotiate that with me. That is a huge no-no. Two, you doing that, that's the excitement, like, oh, she's going to get mad at me. He's pushing just to see what he can get away with. there are a lot of guys that, doing the foot fetish, and there's so much that links up. I'm being naughty. I'm being gross. I shouldn't like feet. So, but it makes me happy and, kind of gives me a tingle in my special place. And if she kicks me, then, I'm being punished for liking feet. And those are the stories I love to hear. I'm like, I want to hear it. Like, how did this happen? Well, my sister was having a sleepover once, and I really had a crush on her best friend, and she stuck her feet in my face, and he had such a crush on her. Now he's linking that the butterflies that you feel when you really like somebody with the foot, and then all of a sudden she kicked him, and he was already feeling a tingle in his special place. So now you got the foot, and you got the tingle, but then you got the pain. Oh my God. And it's like, oh, look at that.
It was all linked. It
happened at a slumber party when you had 12 years old. You got your ass whooped by your sister's best friend.
That's so interesting. Being a hired mommy takes a lot of energy. What is that worth to you per hour, just as an estimate? Because for me, bossing someone around, making decisions for them, being their dominant person, what do you charge? What is it worth it for you to take on the responsibility of being somebody else's mommy?
It can be anywhere depending on everything involved, because negotiation is a huge deal. Whether it's going out on a shopping trip, or whether it's an in-house thing where I am guiding him or her, cleaning the house, doing the laundry, doing it the way mommy says, do this, do that, do the other, and all power is taken away from this person. That does take a lot of energy, and normally something like that I'll only book one session a day, because I have to pay attention to my mental health as well, and I have to regroup and kind of relax and take a moment for myself before I focus on the next person. And it can be, when I do it now, it's $300 an hour. And if we're doing a whole day, I will definitely work with somebody on that. But it's $300 an hour. I always say I don't roll out of bed for less than $300 an hour. And because it's so much prep, all the way down to what I'm going to wear, how I'm going to do my hair. I can't go in there in tank tops and shorty shorts, saying, oh, I'm the mommy. That doesn't fit. Every single detail is looked at. The way my hair is pulled back, pulled up. The type of shirt or blouse that I would be wearing. If I'm wearing a skirt, if I'm wearing low heels, with a little strap on them, almost like Mary Jane's, all the way down to how tiny my earrings are instead of hoops. So it starts the second I start thinking, okay, we've got an hour and a half, 2 hours to get ready for this. So it is taxing, but it's rewarding at the end to see somebody reset and come out like they finally took a deep breath. And that is very satisfying. And I always, even once the session is over, I will take my personal time, and this is a thing for me, as well as with them, to do an aftercare, to sit down and say, how are we doing? Let's revisit where we were at the beginning as opposed to where we are right now. And, even if it's just a really long hug, because that mommy hug is huge. That's a really big deal. So it's something like that. It can be a super quick thing. It can be a 15, 20-minute discussion, and that's okay because you're giving back, and that's the feedback of helping someone. You two know that. When you help
testify
somebody,
that that your hugs are very top notch. Thank you.
And it's funny because I don't push the hugs on anybody. I will move in slowly and see if it's receptive. You know, are they going to receive this or not?
Sure.
And I'm available to you, and I'm letting you know I'm available to you. Are you going to come to me now? Because I'll never force, oh, you just need a hug. No, sometimes I'm one of those people that I'm not a touchy-feely person. I usually stand back. So it's interesting because I open up just as much as the person that I'm working with, and meet them in the middle. It's an energy exchange. It's a power exchange. It's trust. It's all about trust.
You referenced how there's been a lot of stigma around this type of work. And I agree with that. And one of the things that I did, it just so happens we're having this conversation, I spent a lot of time in the corporate medicine, large organization that I worked in training the trainee doctors on how to support folks who I would call it sexually diverse or different diverse practices in the world. I do understand that fetishes and kink are not always sexual, but I needed a way, because we categorize things, I needed a way to have a title to describe the trainings that I would offer. And I would bring in dominatrixes or folks who may or may not engage in sex work or may or may not engage in this type of work, because I really find that from a medical perspective, this community is very much ostracized in many mindsets. A lot of it has to do with ignorance. A lot of it has to do with our own fears of who we are and self-acceptance. And what bothers me about that is folks don't always receive the care that they need to receive. And so I spent a lot of time wanting to care for folks. And it turns out, right, the estimates for folks, the last I read, who may practice sexual diversity or BDSM kink was 38%, but a lot of them are in the shadows. And I really believe that we should bring folks, everybody deserves high quality medical care. And that includes not being stigmatized or being accepted from healthcare personnel. And so so what you're talking about really makes a lot of sense. You also spoke about consent for touch, and I do that a lot in the psychedelic space, where preordained, and I offer hugs to my patients too, but I'm very careful around that. But especially in the psychedelic space, I go through at least twice in the medical evaluation and right before the journey about the specific ways in which I will touch their body, but it has to be consented on before. If they want me to touch their shoulder, touch their shoulder. If they want me to hold their hand, it'll be a closed hand. If they want me to put my hands on their feet, I will. And I'm very clear with them that I will not manipulate their body outside of needing safety. If they're jumping on the futon, I won't want to restrict, but I will want to try to keep them as safe as possible. And so I have found that folks working in the kink or fetish world, however folks want to define it or describe it, there's a lot of consent around it, which is not always found in the outside world of that. I think there's a lot more consent around it, and I think it's really interesting how you also spoke about your own process, and I see that a lot in parallel process when somebody's having a journey or even in a regular medical visit. I have to check myself, so I go to therapy and I regularly work on myself so that if I'm experiencing a trigger or if I'm having my own process, I don't then put that on somebody because I want to come as clear as possible. So I think there's a lot of parallels with all of our work. It's just about the different categories in which society puts it, but perhaps there's not really we're not really dual. Maybe we're really singular and we're all one consciousness. We just have our own signature.
Oh, I like that.
That's very, very
I really
interesting.
like that. Because I actually know somebody, a relative, that has gone through ketamine therapy and stuff like that. So that's interesting that that's what you do. I'm like, what? You do? I actually know about this. Not a lot, but
there's
I
a lot of parallels.
About it.
There's a lot of
right,
parallels.
right. And there's so much shame and stigma on if you like certain things. Like one of my friends that I've known since I was 17 years old says, I don't understand the feet thing. I don't get it. I said, okay, that's fine. You don't have to, because that's not who you are. I said, but he goes, well, can you explain it to me? Well, no, I can't. But something that I did do is I flipped it and I said, you like boobs? And he goes, well, yeah. Why? Tell me right now why. I need you to give me bullet points, and I want 5. One hand. One hand. How hard is that? 5 reasons why. Tell me now. Right now. And he's like, no, hurry up. Tell me why. I don't understand it. Tell me why. And he's like, oh my God, I get it. Thank you. And now he's so accepting. He's just like, it didn't bother me or anything. I just didn't understand it. But now when you say my brain works for this body part and your brain works for this body, okay, I can't tell you why certain things trip my trigger, and I enjoy. And men with beautiful thighs. Why? I can't explain that. It's like some people enjoy like a little surge of pain. You get into BDSM. And one of my first questions, here's a good one for you. One of my first questions is, do you like sting or thud?
What's a sting versus thud?
Sting is a slap.
Okay.
Thud is a punch. It's more solid.
Okay.
So there's some of them, a sting will make one of my friends do, nope, that's my limit. But you can thud him all day long and and he loves it. He's just like, it's that, where you have to stand there and take it. And, so consent, how silly is that? Okay, we're going to do some sort of BDSM. We're going to restrict you, take all of your power away. Another fun with, instead of tying somebody up and going, what are you going to do now? How about mental bondage?
What's mental bondage?
You have to trust me enough that you're going to lay there or be up against the St. Andrew's cross, something like that, and not move. But nothing is restricting you but the fact that I told you not to move.
So mental bondage, that's a very interesting concept.
That's a level of trust that no matter what I do, that you're going to keep your arms that way.
That's interesting.
And something that's fun, something that will kind of trip their brain a little bit, is if they move a certain way that I told them not to. Like, you wouldn't be able to move that way if your wrists were tied. So the second they do something they're not supposed to do, I stop.
And what do you do?
I walk across the room and I just stand there because now I'm not pleased. I told you to do something, you didn't do it. And it's like, oh, it's taking all of that power away. As soon as they relinquish the power, then but they can get up and walk out whenever they want. And it's that mind thing. And I like twisting those things. Like, oh, why spend extra time tying somebody up when I can just say, stay? And it plays with their brain. It's very interesting to do something like that. And people that are, but also you get some people that may be on the spectrum and being tied very tightly, it's calming to them. So I couldn't do something like that to someone that's on the spectrum that enjoys that feeling. They feel safe. Being tied down is like the biggest hug ever, and another reboot. By the time they're done with their session, it's like they come out and their whole body just took a deep breath. It's like they just got back from vacation, and it's like, oh, whew, I needed that. So there's so many different ways to do things, and everybody thinking, oh, BDSM, bondage, you have to hit them, and no, I don't strike somebody unless it is strictly requested. you know. Also, another thing, like you were talking about going to therapy and kind of keeping yourself in check. Anything that I do, I have experienced. So I've been put in situations, I have been tied down, I've been hit with things, I've gone through that feeling of humiliation. And, you know, when somebody comes at you with their words so hard, and all of these different emotions that you get to shake off, you know, because mommy dom is doing it, or your dominatrix is doing this, depending on what role you're looking for, and to break them down, to build them back up and make them a better person when they walk out.
Or perhaps access the person that they want, that they are when they walk out. Maybe we are already amazing. Perhaps we just want to. It's just about learning to access the aspects of ourselves, the healed aspects of ourselves, so that we may be whole.
Thank you both so much. I am not an expert in the fields of fetishes or medicine. I am still learning about these areas. And so in mental health, people come and talk to me about all sorts of things that they don't sometimes want to talk to anybody else about. And they ask me whether or not it's shameful, whether or not it's aberrant. And I don't have any developed thoughts or expertise on the matter. So a lot of times I do what is called statistical therapy consulting, which is basically I just spit back statistics towards them. And instead of saying what I feel, because I don't have any developed thoughts on the matter, I'll say, oh, you know, you have binge eating, you say that you have binge eating disorder. That's about 2.8% of U.S. adults experience that in their life. Oh, yeah, you drink every night. Well, you know, about 5%, a little bit over 5% of people worldwide experience alcoholism. Oh, you're addicted to sex. Oh, well, you know, about 6% of people, they report to being having experienced alcoholism at some point in their life. Gambling, 0.42%. Foot fetishes. That's something that, even though it's not necessarily common among the general population, among the fetish community, it is something that's reported among approximately 40% of the fetish community. So we have all of these percentages, and sometimes I just spit back statistics at people. How do you feel like you serve people best? And how do you see statistics fitting into any of that, if at all? Like, how would you estimate percentages of people who come in with, okay, let's start with the question. What percentage of people do you see in your private practice, Dr. Soto, in your concierge physician practice, who their primary concern is health behavior that is stigmatized? And Ms. Stone, what percentage of clients do you see who, or patrons, do you see who they come to you because of stigmatized behaviors?
Yeah, so I can start there. What's interesting about that is we may not always be aware. So what really tends to bring folks in is a few different reasons. One is some folks who are really interested in preventative care and wanting to maintain health. Others will come in because of symptoms. And a lot of time, we can experience strong sensations in our physical bodies, and some of those can be unpleasant. And for that is a big reason why many folks access medical services. And so there may not likely be an awareness of there being shame or stigmatization involved in that, because a lot of times we have learned, or many cultures, I'm Latinx, I'm Latina, and my culture in particular, having the request, oh, I'm seeking care for anxiety, is very stigmatized. So instead, and anxiety can be experienced in many different ways. And so instead, the presenting complaint or concern has to do with much more abdominal pain, some sort of pain, some sort of recurring symptom. And so it is my job to sit back and stay in a place of curiosity when I may not understand something, and also reverence and respect, because bringing up the idea of stigma or shame may break irreparably our relationship. So I need to sit in a place. And one of the other things that I have learned is if I see someone and it seems to me as though, yes, there may be a pattern of anxiety, but this happens a lot in the medical community, where because there's many challenges with the industrial health complex, which is why I needed to leave corporate medicine and open my own practice. Just for me personally, I feel the need to spend more time with patients. I was unable to support patient care in the 7 to 15 minutes allotted. And so I would find myself spending more time, but I still had the same amount of work, if not equaled the amount of work, if not more, because when one speaks a different language, it's a whole other bag of wax or ball of yarn, so to speak, that comes with that. And so I would end up spending more time, and then my body would pay the price with that. So what I'm doing now is I spend time listening. And one of the things that happens a lot, particular to people of color, particularly to those who present as female, is people getting dismissed. That is very important to listen to and work up, right? And so I sit and I listen, and I do run tests and labs, but really the most important thing that I believe that I do is I listen, actively listen to understand rather than listen to react or respond. And I stay in a place of curiosity. And so some of my patients are only ready to talk about the physical plane. I'm happy to do that. When I start finding that all the different things that we are addressed now, can gut health improve anxiety? Absolutely. If we improve our gut health, it can certainly improve anxiety. However, sometimes other work needs to be done. And so I really sit in a place of reverence and respect. So I believe that it's possible that most humans have experienced shame in their life. I believe it's possible many of us have felt shame, embarrassment, emotions like that, which are not often discussed because they are difficult, right? There's no bad or good emotion. They're just pleasant ones and unpleasant ones. And so I sit in a place of curiosity about, there may be, with health-related behaviors, it's been shown very clearly that just informing somebody, for example, smoking cigarettes has been linked to lung cancer. That information is pretty widely known, but that doesn't necessarily change health-related behavior. And so what I have sat with my own health-related behavior. And when I sit in a place of understanding, or sit in a place of curiosity, even if I don't understand, I sit in a place of curiosity. And what's important is for me to offer the tools and patients to decide what is best for them. And even if I may not medically find that their choices to be in their highest good, I understand that there's a reason for it, and I respect it, and I sit back and allow for information to go back and forth without a place of judgment. And why have I been able to do that is because I'm learning to not judge myself.
That's very interesting, and that actually brings up a question that was unplanned for this interview. But how do you let go of the outcome? And I'd love to ask you, Ms. Stone, about how you do this. This is something that, I joined at your most recent foot party. I had an emotional breakdown, and the reason for it on my part was because I failed to satisfy one of your patrons, and it's because I didn't know how to satisfy what it was he was looking for, and that was so hard for me because I'm so performance driven. And the fact that I didn't satisfy or please one of your patrons, it's been haunting me. And I don't know how to psychologically deal with not. Can you give me any tips?
Absolutely. And that's one of the things that we actually have referenced on our How It Works Rules of Fun on the website is not every session is going to work out. So I always say negotiate out what it is. If it is not something that you're into, or I always use tickling as a reference for this. People will come up to me and say, oh, I would love to do a session with you. You know, I love tickling. Okay, you want to tickle me. I'm not ticklish. It's not going to work. That fun, that playing with the feet and tickling them and all that, I'm not your girl. I cannot satisfy you in what you're looking for. And that's okay, because we can find somebody else for you. Who here is ticklish? You know, I cannot be everybody's cup of tea, and I'm not, and I know that. And being okay with saying, you know what, I don't think I'm your girl, but let's figure out how to fix that. Let's figure it out. We can do that. So just going, oh yeah, I have feet, so let's do a session. That's not how it works. That is not how it works. I'm not everybody's mommy dom. They may do a session with me and go, you know, yeah, it was just because I'm very polite. I say, please, I say, thank you, but I mean it. I have other people that are like, no, I want you to constantly scream at me. And, you know, that's really not me. And that's going to take energy that I'm going to have to drum up, because it's so out of my character. So I have to stay true to who I am while doing these other things. And something that you were talking about with the communication, the negotiation is huge, because the negotiation goes right into consent. And consent goes both ways, with whether you're the dominant in the situation or the submissive, or you're just agreeing to meet in the middle. And that's what foot night is kind of meeting in the middle and just having a good time. It's just a fun party. And but the negotiation is huge, because I've had some guys go, well, I really like to be humiliated while I'm licking a girl's feet. Okay. Well, you know what? I got 3 pro doms here. Who wants to bully this guy? You know, and we make fun. We have fun. I'm like, now you can bully him, but you better come back and tell me you had a good time. You better still be nice. And I'm having a good time with what he wants, but I'm also not going to send a guy like that to you, because that's not who you are. I would never take that guy who wants to be put on his knees, foot shoved down his throat, and humiliated. That's not who you are. So I would never lock you two together and go, oh, what's your problem? You're a foot model. What's your problem? That's not what it's about. It's about finding that match and finding that energy exchange. And if you don't think that you can bring that energy, go, you know what? I don't think I'm your girl, but we're going to figure something out.
There's always a plan B. There's always a plan B.
There is. My thing is with stats, yes, there are other people out there like you. There are. You're not the only one. Nobody is that special to be the only one. So let's not do that to yourself and think, oh my God, I am the only one with a foot fetish. No. I'm the only one that likes to be trampled on. No. Don't put that pressure on yourself. But when they're like, oh yeah, I feel like, it's one of my friends, I told him, and he said I was gross because I like licking dirty feet and all this stuff. And okay, well, that's a little different, but you're not the only one. I know. I know, quite a few. So they're not the only ones. So take that pressure off. And where did this come from? Like, let's track it back. Okay, so you like this version of it. You want him to look dirty from the shoes, or do you want her to literally walk outside and you want to see her get her feet dirty? Because I've had that happen at an LA party. So it just all okay. So, and there's so many times like overeating. Let's track it back. What's your favorite thing? Oh, when it's past midnight and and nobody's around and I eat 2 super meals in my car by myself. Where did that come from? Let's go ahead and track it back.
I was so grateful for the opportunity to be able to interview all of the foot lovers at your parties during their foot sessions with me and ask them about the origin of their foot fetishes. And for every single individual that I spoke with, it all started before the age of 10. And so that was very interesting to me. They had core memories starting from age 5, age 6, age 7, and it was all linked to some crush on some person at a very prepubescent age. Fascinating.
Yeah, and that, because you interviewed people about thieves, and I'm always so fascinated because I've got a couple of friends that are therapists as well. And they're like, yeah, the origin stories are huge. And figuring out like the playing soccer on a co-ed team, and the girl came up to kick the ball away from him, ended up nailing him in the balls, but he really liked her. So that excitement, the adrenaline of just being around her, and then that pain, and then you have to suck it up and keep playing. And those things are so interesting. I did a session one time where a man had me step on his little finger with my spiked high heel. That's interesting. So I'm like, okay, I'm not going to break it, but I'm going to cause a little pain, dude. And so we went through the session, and my little talk afterwards, making sure that he's okay, I'm okay, and we had a good session and all of this stuff. And then that hug. And I said, I have to ask you, where did that come from? And he goes, I was always fascinated with shoes, because shoes were not allowed in the house. They had to be put by the front door. And his aunt was the only person that wore spiked stiletto heels. And one time he was laying there playing with his cars. So he's like, what, 5, 6? And she put on her shoes getting ready to leave, didn't realize his hand was down, and she stepped on his little finger. And to that day, that fascination with that style of heel and all this, he's in love with the shoes. It wasn't so much a foot fetish, it was a shoe fetish.
Yes, yes.
And he linked it with that pain in that body part, his little finger.
Knowing whether, when, and how to draw the line ethically and legally. As health providers and business owners and people with a sense of ethics and propriety, how do we know when or where to draw the line between business profit and client well-being? In mental health, I've struggled with this concept for, maybe a couple decades. I just always thought, well, what do therapists, how do they know whether or not to say that their patients continue to need support? If they need money, then they should say, yeah, you need my support. Just like a pineapple seller would say, you need these pineapples to make you strong. But maybe people don't need to continue to be paying. So how do we draw the line between what's ethical and legal and appropriate and in accordance with our own personal sense of ethics with regard to what we recommend to our patrons, clients, patients?
Yeah, so when we think about that, and I'm glad that you bring up this question because it also harkens to something that both of you were discussing before. about comfort. This is really about comfort with discomfort. And letting go of the outcome, I really think it has to do with being comfortable with our own expectations of ourselves. And this also goes very, very keenly with the idea of how do we maintain our ethics in a world that may be considered the Wild West or very not regulated. And so I have a medical board, a governing board, and so I do look at that. Whenever I say something or whenever I express myself to a patient, I think three things. Is this for me? Is this for both? Or is this for them? And if it's for both and it's for them, then I'm comfortable saying it. If I'm saying something just for me, then I need to really look at that, because this is a relationship that's really for the greater good of both. But I'm really here to facilitate and focus on and witness the healing, somebody healing themselves. And so I come from that place of high ethics and reverence while also taking care of this human, because that's what I'm here to do.
How much pain medication are psychiatrists, are medical providers like yourself legally authorized and able to provide, and how much do you feel comfortable providing?
Pain matters. And years ago, it was considered the fifth vital sign, and it really does matter. The problem is that we don't necessarily have all the perfect tools for taking care of pain on the physical plane without looking at the emotional, spiritual, endocrinologic pathways. And so what that means on a physical plane is, yes, I work in the world of ketamine, but I really want folks to do a ketamine journey with me. And I'm not really proposing, lots of folks do microdosing ketamine, and I don't have a major practice with that. I have a population of one doing that now for alleviation of pain, because I'm very careful in this arena. I've spent a lot of time working with folks in the opiate world, and that's a slippery slope, and folks need alleviation of pain, but then we get something called tachyphylaxis, which means you need more and more and more, and it can be very difficult to navigate that. But then there's emotional pain, and sometimes opiates are used for emotional pain, and the problem is it gets us into a hole, and there's more and more dependence. So I do come from a place of respect and reverence while also within the boundaries of where I'm going to work, because sometimes folks who have had the experience of long-term opiates and have had long-term changes, because there's adaptive neurologic changes, and then there's maladaptive neurologic changes, and some can come within the opiate or substance use world. And so sometimes that can translate into abusive behaviors towards those who are trying to care for them. I come from a place of they are doing their best in the world. I have wounds too, and I have to protect myself too. And I've been threatened. I've been threatened to be killed. I've been threatened in a lot of different ways because somebody is in a deep emotional place of pain and physical pain. And I don't blame them. We're all doing the best we can. However, it's also not going to be good for the community for me to put myself out there to be killed. So I work with folks who have benzodiazepines is another one. I will work with folks if somebody comes in with the goal of wanting to taper off, I'll work with them. If somebody's coming to me with the goal of maintaining, but benzodiazepines are very important for a group of patients that I take care of that have mast cell activation syndrome, and that is not a substance use disorder. This is helping their mast cells calm down. It's a very different thing. And these patients in this subset are extremely respectful of me. So it's important to tease it out as well. And so I look at each case and I'm present with each case. But if somebody is simply using benzodiazepines long-term on a really regular basis, then I just want to sit with them and talk to them about goals. And if they want to just stay in that place where they're just going to use the medicines for the anxiety and not explore other perhaps root causes or other associations, then I might not be the doctor for them. It doesn't mean that it's wrong for them not to want to explore that and just stay on the physical plane, that is their right. But I let go of the outcome that not everybody's going to want to explore themselves. And I really respect it because it's a hard, hard journey to go within. Sometimes it's beautiful and worthwhile, but having done it myself, I understand that. I'm just also, I am only so capable of providing something. And so I let go of my own need to be approved of or be the hero. No, I'm not in hero work. I'm in collaborative work where community is medicine. And I have some skills, and I also have some areas where I'm not able to serve the needs. Doesn't mean those needs are wrong. It just means I'm not able to serve them, and they may need to find somebody else who's more comfortable in that plane.
Thank you so much. That's very helpful.
I like that. And when it comes to, it's the same concept with what I do. I do not push for the money, oh, I got to pay rent. So you need to get a session with me, or you need to spend a day with me and pay me this much money. I never do that. It is, they come to me. I do not push anyone. The person that I helped go through a divorce and due to religious beliefs and everything, he had a really hard time talking to his family. With that, at one point, you have to know if you're doing it for self-centered reasons, like, oh, I need to pay my bills, or if you're actually doing it to help somebody. Because I started backing off and letting him, it's like, oh, look, it's like pushing the baby out of the nest, the little baby bird out of the nest. Is he ready yet? Or is he going to stand there and go, nope, I need you right here, and reading what they're doing and what they're needing from you and why. Am I now a crutch because he's afraid to go out there alone again? That's not helping him or me. And I never want a reputation like that. And in what I do, I haven't done any of the schooling that the two of you have done. And everything with me is reputation and being kind and consent and knowing what I'm getting into, and also knowing this isn't my cup of tea, and I'm not okay with this type of thing because it's outside of my character. So let's find you somebody that I will help you screen somebody that is safe and will treat you well and will know how to let go. Also, when it comes to any type of drugs, alcohol, anything like that, since we touched on that, if you're having physical pain or anything, I expect you to be on a good regimen. We all will eat the whole Snickers bar sometimes, but you can't live off of Snickers. You have to have a good, well-balanced diet. And I'm human. I love cheeseburgers, but you have to balance it out really well. Also pay attention to if the person is going to a therapist and it's going well. I don't want you to tell me about it. That's not why I'm here. But I think your therapist needs to know you're seeing me. God, I love what I'm doing now. I really do. And it's not out of greed. It's not out of being a bully. I don't hate men because I deal mainly with men. I don't hate men. My mother had that misconception. Oh, she does this because she hates men. Actually, I love them. They're the most wonderful plaything on the planet. Why would you want to break your toy? Who wants to play with a broken toy? I would never do that. I don't like broken toys. I want a perfect, pristine little toy that I get to play with that comes to me and goes, can we play? And that's a beautiful thing. I also have a weird thing in my tiny brain where I don't like to be called mistress or goddess. I'm not a mistress. I'm not the other woman. And I'm not a goddess. Zeus isn't my daddy. So you may call me ma'am, or you may call me Miss Stone. You can call me Miss Joclyn. I'm okay with that. Show me a term of respect. But I'm not going to give myself some title that I feel that I should wear on my boat. You should know who I am. No, that's negotiated. When I get that attitude, it's because we negotiated that. Don't you know who I think I am? So, just being very humble and knowing when to, sometimes you make a hiccup, sometimes something will happen, and something I said or did, I may have hurt his feelings a little too much, and it took a moment to pull him out of that. So, you know what? Next time I won't get, I am sorry that I did that. And next time I'm going to keep myself in check. I'm going to go to a level 3 and not a 5, because you weren't ready for a 5. And that wasn't okay that I did that. So, and knowing when I do something wrong and going from there. So, but I never make it about the money. I've got jobs, I've got my businesses and stuff. And so when I am hands-on with somebody, and even with Foot Night, I make sure that I have people that are there out of a kind space. They're balanced, like you're saying. They need to be balanced and be nice. I've got pro doms that have the biggest smile on their face, and they're like, "Hi, how are you? What is it that you like about feet?" And they're playful, and not all dominatrix need to be mean. And I really focus on who is in that space, and who is even the guys are comfortable when they come in and go, "Dude, I haven't seen you in a couple months. You doing okay? Let's do a double session later." and it's fun because they're so comfortable, and it's like, "Oh, I did that." That's
community
my
did
moment.
that. Community did that. They did that too.
Yep.
Community
I
did
start
that.
putting them in there, and then I let them go.
Yeah.
And then I get to watch, and it's like, oh, yes, because you can pick out the bad apple. You can find it. Get it out of there quick. And so I never base anything off of money, but I will make sure medically people are taken care of, eating disorders, things like that. I'll address things, and go, okay, we need to get you in to see somebody. I'm not that somebody, and I know my limit. Now, I am not that somebody, but let's find somebody for you to talk to, and go back to when you were 12 years old and your teacher told you, "Oh, look at you. You've always got something in your mouth. You're always eating." Yeah. I actually had that happen where one of my friends had a eating disorder, and I started talking to her like, let's track it back. And that's what it was. Somebody was mean to her, and she never forgot it. It was that moment of, she was a child, this was an adult, and their one snide, vicious little comment while they were having a bad day affected somebody in the long term. Yeah. I'm like, oh, we're gonna figure this out. We're also gonna, get her out of your head. She doesn't belong there. Yeah. It wasn't fair. It wasn't fair, and she doesn't belong there. Let's not let her live rent-free in your brain.
I feel like this is a therapy session for me. I'm like revisiting my childhood, my eating behaviors. I'm like, yeah, this is interesting. Yeah. I am so about transparency and authenticity and reporting that whenever anybody says to me something like, "Hey, I have a request of you. I'm not going to share this with anyone else, and you and I see each other in the street. We don't know each other. You keep this between me and you." I don't feel comfortable. I feel comfortable with all sorts of requests. Like, people have been asking to chew on my feet and to hump my shoes. And I'm totally comfortable with these requests as long as I can take notes on them and they say, yeah, you can share about it, But as if they say, listen, this is something I'm not comfortable with, you tell my spouse I'm going to kill you, then I feel like, well, wait, it's kind of like if a tree falls in the forest and nobody heard it, did it really fall? I just feel like life is about documenting what happened for the public and for future generations. And so I guess we all have a different sense of ethics and propriety. And I feel like I'm just part of a much, much, much bigger picture. And if what I experienced doesn't go down in history, then I just feel like it's pointless. There's no worth to it.
Interesting.
See, but there is a part of that where it can go down in history, and it's your history, it's your life, and all of that. And something that I do, on the podcast that I do, I tell all of these stories, and I've told you a few. Oh, I've got a girlfriend. Oh, I have a friend. I have a guy friend. I don't need to say their names.
That's true.
It's still a story that happened to me. It's my story. Now, I'm telling you my version of it, but I never have to attach somebody's name and go, it was her. She did that.
That's true.
I don't need to, because me telling my story, what was, or my few of them, little tidbits, you got something out of it by going, oh my God, I feel like I'm going through a therapy session. Mm-hmm. Now imagine if I wasn't allowed to tell a story by omitting names, changing the name for the innocent. I just don't say names. That's all. I tell stories all day long. I don't say names because if they want to tell the story, they can. But my version of the story and the part that I got out of it, like the one that went through the divorce, and then I got him to the point where he was dating again, and I miss him. I miss him because he outgrew me. Mm. He succeeded, and I did my best to help him succeed, and my goal was to get him on the side of that nest and pop him off.
Thank you so much for taking the time to watch this episode of Post-Conventional Psychology, an informative exploration of diverse international and local perspectives on the practices and professions of psychology and statistics. Today's episode featured the voices of Dr. April Soto, a private concierge physician with Lalim Health, Ms. Joclyn Stone, president of Foot Night International, and myself, Dr. Anna Yu Lee. You can find more about all of our work at the links provided. Thank you again to our sponsors and viewers.